My name is Thomas Dowling. I'm a Paediatric registrar in Belfast, and I have an e-poster at the conference this year. It is looking at the elective spinal cases that are done in Belfast and whether or not they need to come to paediatric intensive care afterwards. So the current standard protocol would be that all those patients are admitted to paediatric intensive care post-op for their care, and it was anecdotally felt that these patients often didn't require very much intervention from the paediatric intensive care team. So we looked at 2 years worth of patients. We identified 42 patients, and of those 42, only 3 of them actually required any level 3 or level 2 interventions, which would be paediatric intensive care interventions or high dependency interventions. So as we had thought, a lot of those patients probably could have been managed safely on the ward. So we've been looking at existing literature to see whether there are other guidelines out there for how these patients can be safely managed outside of an intensive care setting. We're slightly unique in Northern Ireland in that we don't have a high dependency unit in the province. So often these patients would be cared for in a high dependency unit post-op rather than a paediatric intensive care. So we've been working with the relevant stakeholders to see if there are ways that we could adapt to have a high dependency environment, be that on the surgical wards or elsewhere. And we've been working with other projects to see if we can develop and prove the need for a high dependency unit in Northern Ireland.